Thank you so much for being with us. My name is Kim Porter. I'm the Executive Director of Be a Part of the Conversation. Very thrilled about the other presenter we have with us today. I'll be introducing Mallory Henry in just a moment. But first, I want to thank the Montgomery County Office of Drug and Alcohol. This program is part of a 5-year grant. As you can see from the dates there, we're wrapping up this 5-year grant that we have called the Youth Marijuana Prevention Project. But fear not, we will be talking about cannabis plenty as we go into the future. The follow-up for this program is on our website, conversation.zone/cannabis. That's where you'll eventually find the recording of this program. Give us a little time to process it, but it will be there, and as well as our YouTube channel. But you'll also find on this page a lot of resources that Mallory and I will be referencing, and just access to other programs that are about cannabis and about talking with youth. We also have a YouTube channel that has a lot of content on it. As I mentioned, some of these programs, like the one today, are recorded, and we want you to have access to that all the time. So lots and lots of things to take a deeper dive into on that YouTube channel. I want to make sure that you all know about a program or service that we have called Parent Partnership. These are meetings that are kind of similar to Al-Anon and Nar-Anon, but they're support groups, predominantly where parents, guardians, grandparents in that parental role. We have 21 meetings every week. They take place, about half of them are on Zoom, half of them are in person here in the Philadelphia region. But you just click on any of these buttons and you'll get the details about the location, if it's in person, the Zoom link, or the contact for the meeting if it's on Zoom. We also have a service called the Family Recovery Course. This is a 3-part peer-led course for parents, guardians, and grandparents who have been impacted by their loved one's addiction. This is not a prevention program. This is for someone who, yes, we know that our child at any age is struggling with substance use. It's peer-led. It's got terrific curriculum with it. We've been getting great outcomes. It's capped at 12 people, so it's quite intimate. And after just 3 sessions, we are so connected to one another in this course, and it's leading folks to more support, more resources for treatment, and support for their children and for themselves. Okay, so I'm going to introduce you to Mallory Henry. I'm going to be jumping in again after Mallory does her presentation, but we're going to start with Mallory. I really love working with Mallory. She is the Senior Coordinator of the Student Assistance Programming at Caron Treatment Center. Mallory, floor is yours.
Thank you. Thank you, Kim. I love working with you and just seeing all the good work you guys are doing as well. I'm always reminded of how many resources are out there as well. So thank you everyone for being with us today. So again, my name is Mallory Henry. I'm a Senior Coordinator of Student Assistance Programming / I always say education for Caron Treatment Centers. And really goal today is really to talk a little bit about, that communication gap. So Kim will really kind of dive into, what does that gap look like? I wanted to really talk about what is the perception of cannabis, specifically with our youth today. And then what specifically can we do, whether we're parents, guardians, loved ones, or, professionals who work with youth, related to changing that perception. So for those of you who are unfamiliar with Caron, Caron is a nonprofit treatment provider, a behavioral health treatment provider. Our headquarters is located in Berks County, Pennsylvania. We also have 2 facilities in Florida. We treat young adults through elder adults. We also have regional locations, one of which is in the Plymouth meeting area in our Philadelphia region. But we've been doing that behavioral health work for over 65 years, so a really long-standing tradition of good behavioral health treatment. And with that comes the education and prevention end of things. So within my department at Caron, we provide prevention, early intervention, education for students, professionals, parents, caregivers, and we've been doing that for over 30 years. We work with students really up and down the East Coast, providing programming in person, virtually, digitally, lots of different avenues related to prevention initiatives. So I'm always happy to collaborate with organizations like Be a Part of the Conversation. Just a little bit more about myself. You're seeing my hair at different lengths in all of these pictures. Prior part of my role at Karen, I've been in the behavioral health field for over 15 years. I've been with Karen for 12 of those years. Part of my role is kind of twofold. I oversee our prevention and early intervention services in schools in the Lehigh Valley and the Philadelphia region, which any really of those counties kind of outside that Philadelphia outskirts. I also oversee Karen's regional family services. So I also oversee any services related to family members who are impacted by substance use disorder that is taking place outside of Karen's inpatient facility locations. So we host monthly webinars. We collaborate a lot with the parent partnership meetings that Kim mentioned at the beginning. And provide workshops at Karen's regional offices. I also run a sibling support group. I am the sibling of a person in long-term recovery. I talk a lot about that in some of the work that I do for family services, but I also run a sibling support group that meets virtually once a month. One of my other pieces that brings me to the table today is that part of my role within education is really to oversee our cannabis prevention and early intervention initiatives. It's working not only with the clinical staff at Karen, but also just the education staff who is working in schools to say, what are we seeing and what do we do related to kind of cannabis specifically? Prior to coming to Karen, I worked doing family-based therapy in Bucks and Montgomery County. And then prior to that, went to school with an undergraduate degree in secondary education. So you'll hear the teacher come out at parts of this because that is a passion of mine as well. So I wanted to start by really looking at how do our children, students, whatever avenue you're coming from, whatever lens you're looking at this topic through, use and think about cannabis today. Because I think if we asked you to think about it 15 years ago, it would be vastly different than what students and children think about cannabis today. So I'm going to show some data to you, which actually just recently came out. We were just talking about how I was excited when I was putting this together that the data had just come out. So the Pennsylvania Youth Survey is a survey that is offered through the Pennsylvania Commission on Crime and Delinquency, or PCCD, every odd year. So 2023 in the fall was a facilitation year of the Pennsylvania Youth Survey. And we've been doing this survey in Pennsylvania since 1989. So this is really a longitudinal study looking at students' views related to substance use, mental health, and their perception of those things throughout, kind of time. So the 2023 data, so it was facilitated in the fall, usually that October, November timeframe. We had just over 1,000 school districts across Pennsylvania participate and looking at valid responses. So obviously they do comb through the data to pull out any that don't seem to be valid responses. And we had, just over 260,000 responses that we're looking at. So the data I'm going to be showing you is through the whole state of Pennsylvania, just because I wanted to give you the most broad data set. However, the Pennsylvania Youth Survey on their website, and if you just Google Pennsylvania Youth Survey, it pops up, will give you data specifically to counties as well. So if you're interested in a specific county, you can look up that. Individual school data is not publicly released. It is released to the school districts, and they can choose whether or not to make that public. So if you're curious about your school's individual data, you would have to ask administration at that school district for that data. Okay. But I pulled just a couple things from you from PAYS to kind of show you in terms of what we look at when we look at what are children using when it comes to marijuana. So the PAYS survey looks at 6th, 8th, 10th, and 12th grade. So they do every other year. This year they did pilot a 4th grade survey, but it was strictly a pilot. So the data was not publicly released, but the hope is to incorporate younger grade levels as well. Not necessarily to see if they're using, right? The hope is that they're not in 4th grade. However, we can look at perceptions around substance use or what media they're taking in related to these things that will be helpful as we develop prevention. So what I have here is the last PAYS we have, so 2021, compared to this year's 2023 data. So you can see here, this is asking lifetime use. So we look at two different measures. We look at lifetime use, meaning have they tried it? And it's weeding out, kind of that have they tried it with the point of mind altering, or intoxication. And then have they tried it recently? So this specific table you're looking at is have they tried it within their lifetime? So you can see here that our numbers were pretty consistent from 21 to 23. We see a slight dip in 10th and 12th grade, and that's good. I hope that dip continues. Will it? Don't know, but the hope is that it will. But we're sitting pretty consistently in these numbers you can see here. So the one thing I take from this is that we have less younger students trying it than older students. The other thing I take from this is when people try it, they might continue to use, and that could be why that number is potentially going up. It also shows us that, people are willing to take more risks the older they are that they get, right? So in 12th grade, we have almost 30% that have at least tried it. So when we look at a more acute measure is have they used it within the past 30 days? So now we're looking at, did they try it once and then did they do it again, right? So have they used in the past 30 days? And we assume these numbers are going to be less than lifetime use. So you can kind of see here where we're at. I think the interesting thing here is we had a decline in grade 12, but an increase in that 10th grade, right? So we saw a pretty significant increase actually in 10th graders saying that they have used marijuana in the past 30 days. Okay, so what also this tells us again is that, if they use once, they might be more inclined to use again, seeing these numbers go up from grade to grade. So these, two specifically, the 8th and 12th with this increase between 2021 and 2023, shows us a couple things about perception, which we'll talk about. And we have more students using, and we have more students using marijuana more acutely, meaning they're using it more than just once in a while. I wanted to throw this in here because this is sometimes where it gets a little gray in some of this conversation, is asking students if they vape. So we'll talk, a little bit. And I think if you're interested in some of that, I know, be a part of the conversation. The website that was put in the chat has phenomenal resources related to just cannabis in general. I know Ben Court just did a really great webinar for them just a couple weeks ago that I watched. That's on that website. And they give great information kind of on that background of what is cannabis, how is it used, things like that. I'm not going to dive into that today, but just know that those resources are out there for you and all in one place. But in terms of vaping, we see this as a concern with youth. And we also see that youth, we see them vaping cannabis, right? So one of the things you'll see here is that we do have, pretty consistent rates as well. We're seeing a little bit of a decline in vaping, which is good. So this is that have you vaped in the last 30 days? But the interesting piece of this is of the students who indicated that they have vaped, how many of them were vaping cannabis? And this is what I found to be interesting when I looked at this data, was that we saw a pretty significant increase from 21 to 23 of students saying, yes, if I'm vaping cannabis. And we have about almost 50% of our 10th and 12th graders saying that if they are in fact vaping, they're not just vaping nicotine, they're also vaping cannabis. And I wanted to show this to you because I think that illustrates also just a change in, from an adult's perspective, a change in trend of how cannabis is being used. And we'll talk a little bit about that briefly, but I think this kind of really just illustrates that in a really profound way. So I wanted to show you some other things in terms of how do students and youth perceive marijuana, because this is the part to me that's really interesting, because even if they're saying they don't use cannabis, I'm curious is what is it that they perceive related to cannabis? What messaging are they receiving related to cannabis? So even if they're choosing not to use, do they perceive it as low or high risk? And has that changed over time? Right? So I know this is kind of a lot to take in a graph, so I'm going to highlight a couple pieces for you. But this is asking students, 6th, 8th, 10th, 12th grade, and then this last bar graph here combines them all. Would you feel it is wrong or very wrong for someone my age too? So this first chunk here is drink alcohol. This is rate smoke cigarettes. This is use LSD, cocaine, amphetamines, another legal drug. This one right here is marijuana. So for me, when I look at this, what this shows me is students feel it is less wrong for their peers to use marijuana than it would be for them to use any other substance, right? So you can see here that these rates, especially for 12th grade, and the interesting thing here too is we also see it decline with every year. So every year our students, every grade level they go up, that risk, that perceived risk of marijuana goes down, right? So our 12th graders right here, were about 50% of students said that they don't think, it would be very wrong for someone to use marijuana. Where if we cruise over here to something like a cigarette, we had almost 80% say that it would be wrong for their peer to smoke a cigarette. Right? So I just wanted to show you a little bit in terms of their attitude towards use and how they feel in terms of, is it wrong or is it not wrong? So this is another survey, another question that they ask, and how they word this question is at the bottom here. People are at a moderate or great risk for harming themselves if they, right? So over here we have cigarettes, drink 5 or alcoholic beverages once or twice a week, take 1 or 2 drinks of an alcoholic beverage nearly every day. And these really low ones right here in the middle are if people are at great risk for trying marijuana once or twice or using marijuana once or twice a week, right? This one right here, this third one, is using marijuana regularly. And you can see that these 3 are significantly lower than the alcohol or the cigarettes. So what this is showing us is that our students, specifically as they age, have less of a perceived risk of the concerns of cannabis use, right? And that is concerning to us, especially people in the prevention and the treatment world, because that, again, doesn't necessarily mean they're going to use it, but it means that the messaging they're receiving is that marijuana is not at all concerning, right? And part of that communication gap then is, how do we change that perception, right? How do we change something that we can see every year? They tend to be more and more inclined to think that marijuana is safe and that marijuana is not harmful. Right? I found this one interesting. So this was comparing disapproval. So I would strongly disapprove or somewhat disapprove if a peer my age did this. So this side is if my peer had 1 or 2 drinks of an alcoholic beverage nearly every day. Over here is I would disapprove or somewhat disapprove of someone my age using marijuana once a month or more. And so I thought it was interesting because we rarely see teens saying that something is more concerning for them or they disapprove more of something than alcohol and cigarettes. And we're starting to see that they disapprove of alcohol and cigarettes more than they do in terms of marijuana or cannabis, right? I also want to just kind of briefly talk slightly about why I keep going back and forth between cannabis and marijuana. Marijuana itself is kind of a pejorative term. It comes from the 1937 Tax Act when, the US government said, we're going to schedule marijuana. We don't have enough data about it. We're going to put it as a Schedule I substance until we get more data, and we're going to make it illegal on a federal level. And from that, they took the word marijuana to kind of deter people from wanting to use it. So if we call it something that sounds quote unquote Hispanic, right, or Mexican, it's going to have more people quote unquote disapprove of it. So the term marijuana really didn't originate until, the late 1930s. Prior to that, and what we say now in terms of medicinal is we say the word cannabis because that is actually the genus of the plant. Right? That is the name of the plant. That's where everything is coming from. And it doesn't really have that kind of pejorative, statements with it. But you'll hear me go back and forth because so much of our language in prevention and intervention and substance use disorder really does use the word marijuana. The diagnosable condition is a marijuana use disorder. We're starting to switch to more things related to cannabis, but I just like to throw that out there because I know people kind of question sometimes, like, why are they using the word cannabis? Why are they using the word marijuana? And we've been tasked at Karen to really use the word cannabis. And I know Be a Part of the Conversation does as well, because that is more encompassing. That is the umbrella term. That is the name of the plant. And that is what it is. Anything that's coming from the cannabis plant is still part of the cannabis plant. Right? So looking at that data can often be a little scary, right? We see students using it, we're concerned about use. Even if they're not using, they have this perception that it's not necessarily bad. So how do we change that perception? Right. So the first and number one thing we can do is we can use accurate social norms. So a little bit of the history of the social norms theory. The social norms theory actually came up in 1986 when Perkins and Berkowitz were really looking at like college age student alcohol use patterns. And what they noticed was that students tended to be more affected by what they perceived was normal of a group than actually what was the norm of that group. So to give you an example of that, it would be as if someone went to a party, and at that party, let's say we're over 21 and there was people drinking and consuming alcoholic beverages at this party. They were legally doing so, but one person at that party was drinking to the point of intoxication. And when they were intoxicated, they were saying things they didn't mean. Maybe they were vomiting. Maybe they were causing a scene. Whereas everyone else at that party was drinking responsibly. Fast forward to Monday, you go to work, people ask, how was your weekend, right? What we remember of that party, right, is the one person, right, who wasn't doing what we considered to be normal, meaning they were drinking to the point of intoxication, they were embarrassing themselves. And so we say, yeah, we were at this party, but George over there was making some really interesting choices, right? Now that person has the perceived norm that at that party, everyone was doing that, right? Because that's what they heard, right? So that is a perceived norm. Whereas the accurate norm of that party was one person, right, was acting, out of control, right? And so that is that misperception, but that misperception, especially with developing brains, so our teenagers latch on to those misperceptions, right? So instead of saying, everyone, instead of saying, well, maybe only 30% of 12th graders are using cannabis, they're likely to say, but everyone's doing it, right? Everyone I know is doing it. Everyone in the school is doing it. Everyone in the bathroom is using cannabis, when there's actually no data to support that everyone is doing it. But their brain is making them look at that perceived norm, right? So when we look at a social norms approach, we're really trying to focus on positive messaging about what positive behaviors other kids are doing, right? Like, hey, did we see that this is happening over there? These students got scholarships. These people were really invested in band, right? We tend to not use those things, and we tend to focus on the negative. So the social norms approach is letting people know what the actual norm is, but it's also rejecting that scare tactic, right? Because another thing we know doesn't work is if we tell students, if they use substances, they might get addicted, right? Or their lungs might be, black by the time they're 25. They're not thinking long term, right? So that stuff for them kind of goes one ear and out the other, because they're like, well, that's not going to be me, right? Or my use isn't that bad, right? So the scare tactics, we now have a lot of research saying that doesn't really, in fact, work. So I wanted to give you an example of this. So instead of saying, did you know that 26% of high school seniors have tried cannabis? We want to flip that, right? So I say for adults, I tell you how many students are using. But when I talk to kids, I always tell them how many students are not using. So instead of 26% of high school seniors have tried cannabis, did you know that 74% of students make it through high school without ever using cannabis? Right? And that is an accurate social norm based on our data, right? And that is a flip. We tend to, just as humans, focus on the more negative instead of focusing on the positive, right? So I encourage you, if you're going to use any of the data I shared earlier, but we're going to use an appropriate social norm, right? So we're going to tell students how many students are not doing that thing. The other thing we can do is accurately educate on brain development. We know that the brain develops from back to front, right? So that back of that brain, that cerebellum, is strictly like eating, sleeping, right? until we get up to that frontal lobe. And I actually use this kind of symbol of a hand quite often, right? So we have our brain stem and our cerebellum down here forms first. We then form the inside of our brain, which is that limbic system. That's that emotional feeling center. If it feels good, I'm going to do it. And then lastly, we round out our brain with this frontal lobe that's not really fully online till mid-20s, right? And so what I often say is teenagers look like this, right? They have that frontal lobe online, but then they don't, right? And I hear parents say to kids, like, what were you thinking? Right. And the fact is, they weren't thinking they were going to get caught. They weren't thinking this was going to be on their record. They weren't thinking they were going to get suspended. Right. They were just thought, hey, this sounds fun. I'm going to try it. Right. Because that frontal lobe was not fully online. Right. So oftentimes we say it's kind of like having a gas pedal but very little brakes, right? They're pushing down on the gas, but there's no one there to kind of put on the brakes, right? So that makes a developing brain more susceptible than the brains of adults to outside influences such as substances, right? So we know that there is a much higher risk of someone using a substance and continuing to use that substance potentially to a rate of a substance use disorder if they start in their teenage years before that brain is fully developed. Right. So the Addiction Policy Forum actually estimates that 90% of Americans with a diagnosable substance use disorder began using substances before the age of 18. Right. And that's pretty profound. Right. So that's part of our messaging is also we need to make sure that we're helping students understand that now is the time to build healthy brain chemistry. Right. So it's also that empowering instead of shaming. So instead of saying like your brain's not fully developed, here's why I don't want you to do this. It's, hey, your brain is in this amazing time right now. It is learning, it is developing, it's taking in all of this stimuli to help get you to adulthood. But that's also why we want to build healthy brain chemistry now. We want to learn about healthy risks, right? Like trying out for the school play, asking someone on a date, right? We want to learn healthy coping skills. Like when I'm upset, what is something that helps me feel better? Right? Who are the people I can have an honest conversation with? Who can I be vulnerable about my feelings with? How can I label those feelings, right? We can empower them instead of shame them. Because what we do know with teenagers is they often feel shamed. They often feel like everyone tells me what not to do. Everyone just yells at me. Everyone lectures me, right? No one ever asks me, how can I do better, right? And that's why we want to really empower instead of shame. Right. So let me give you an example of this, right? I just said your brain is not fully developed. You can see how that might sound to someone like very concrete, right? Instead of saying something like now is the time to build healthy brain chemistry. And I stole this directly from you, Kim, because I've heard you say this before. So I'm going to give credit where credit is due because I love this. Because we need to empower students because they have the solution within them. We often want to guide them to it instead of giving them that avenue. And I actually just had this conversation with a student. One of my roles is I do behavioral health assessments and level of care assessments with students. And I was working with a student and we had to talk to his parents about, substance use and recommendations related to that. And the student's parents spoke Tajik and Russian, right? So some Russian dialects. And he said to me, like, so we'll have to have a translator in for these conversations. And so we started talking about language and, things like that. And he was like, well, I was born in the United States. I speak fluent 3 languages. He actually said 4 because they, dabbled in some French that he took in school. And he's like, I really speak 4 languages, but my parents, they really struggle even to learn English because it's such a challenging language. And he said, isn't it interesting that I've been here the same amount of time as my parents and I can speak 4 languages and they can still speak their, original dialect. And I thought that was really telling of how the brain develops, right? Kids can pick up on things so quickly. He was just able to live here and learn the language, whereas his parents have lived here the exact same amount of time, but they were over 25, right? Their brain was kind of set in its ways. So trying to put new information in it was a little bit more challenging. So it's just kind of a way to say, like, it's an amazing time, but we need to use that time to make a really good foundation of just emotional wellness in general. The other thing we can do is educate parents and caregivers, right? And this is a quote I've used from Ben. for years, because when he said this, I was like, hold on, rewind. Like, that really sits with me. He said, unless you have consumed a THC-based product that was commercially produced in the last couple of years, your construct of what cannabis is so antiquated that it's pretty irrelevant. And those who have seen Ben know that, like, I can hear him saying this as well, because it's so true. So when I talk to parents and they're like, it's just a little weed, right? Or I used weed when I was younger, not that big a deal. Or I have friends who smoked weed in high school and they're fine, right? They've gone on to have these amazing, successful lives, right? Have they used a THC product that was commercially, right? Not grown in someone's backyard, not that was purchased illegally, that was commercially produced. Because if not, their construct really is irrelevant. I often tell parents, if you think of flower cannabis, the dried green stuff, if you're thinking that, it's an antiquated view of cannabis, because that's not what our kids are using. Right. I actually just had a school a couple weeks ago call me and they said that a student had a blunt in school. And I was on the phone and the police officer was there and we were both like, a what? Like, that is the first time we've heard that in years. Because typically I'm getting calls for cartridges, for concentrates, for dab pens. I'm not getting calls for dried green marijuana bud. Oops, lost my screen there. So this actually comes from Smart Approaches to Marijuana, an organization called SAM. Ben was actually one of the founding members. They do a lot of research in terms of legislation and how we can be better at legislating marijuana. And they gave this good graphic that I really like. If we look at the cannabis plan and as it grows naturally, it really only grows, with a 0.5% THC. In the 60s, 70s, we saw about 1 to 3% THC. Now, currently, we see around 23% is the average potency of THC, and that is in that quote unquote dried green stuff. It's in the flower cannabis, right? When we look at concentrates, and this is where it gets a little sketchy because we don't have a ton of really good data, related to this. But we see concentrates, and what I mean by concentrates is that pure concentration of THC, which would be in like a dab pen or a tincture or an oil or a cartridge, a smokable vaping cartridge, is upwards of 99%. Right? I literally was with a student this morning and raced home to get to you guys here. And I was asking him, he had breached a school policy. And I said, what was the percentage of the cartridge that you had? And he was like, I was like 82%. He was like, why? Is there ones less than that? Like, it wasn't even things he had seen in terms of being less than that. So when you compare the 1990s 3% THC to the 2024 99% THC, even 80% THC, they're not even the same substance, right? It is a vastly different substance, compared to what it once was. And I don't think a lot of adults know that, right? And so we need to provide that information because that will help us change those misperceptions. Because if kids hear their parents say, it's just a little weed, right? They're perceiving that as this is safe, this is okay, this is fine for me if it's fine for them, right? So I wanted to kind of give you guys some, I don't want to say talking points, but yes, talking points around how do we bridge that communication gap? What do we hear from parents and caregivers or students? And what data do we have to support that that's not true? And one of those is that kids will often tell me, well, marijuana is not addictive, right? You can't get addicted to it. The student this morning just said, like, I heard it's mentally addictive, but not physically addictive, right? And could we have said that until about 10 years ago? Maybe, right? We didn't tend to see people end up in treatment for a cannabis use, but that's not true anymore, right? So the Diagnostic and Statistical Manual of Mental Disorders, the DSM, we also often call it, is published by the American Psychiatric Association, and that helps people diagnose mental health treatment disorders. And they now classify marijuana use disorder as a diagnosable condition. So we have an alcohol use disorder, we have an opioid use disorder, we have a marijuana use disorder, right? We know that it can be mild, moderate, severe. We know that the earlier you are using marijuana, the more likely you are to develop a marijuana use disorder. And in 2015, so this is even at that point, almost 10 years ago, we had about 4 million people that would meet the criteria for a marijuana use disorder in the United States. And I do have a slide at the end of where I pulled all of this from as well, if it's not on the slide. So if you're interested in any of those studies, you can go read them. But it also, recent data is showing us that maybe 30% of people who use it do have some degree of a marijuana use disorder. Right. So I wanted to show you a little bit about what we're seeing at Cairn. This was actually pulled like the very end of 2023. But this was, so when you come into Cairn as an inpatient treatment in any of our 3 facilities, we will ask like what substances you're using, and that could be quote unquote drug of choice, right? So we're categorizing that. And I thought this was really interesting because when I asked our data team and our research department, could you pull the drugs of choice for me for the last couple years? You can see here that the number 2 drug of choice in which people enter inpatient treatment is cannabis, right? So alcohol 1, cannabis 2. It's funny, when I got this information, I said to my husband, I was like, if you had to guess, what would you guess, right? And he was like, well, heroin, right? Because that's what we hear, fentanyl, heroin. And I was like, yeah, that's pretty far down on the list, actually. So again, it's that misperception, right? If it's not addictive, we wouldn't see people end up in treatment, right? But we're seeing people say, I need inpatient treatment. And that's the number 2 drug of choice at Cairn, right? And where there's access for kids, we know that there's use. Right. So even with legalization, with rescheduling, which I know, is potentially coming, we see that. So another thing I hear from parents is I'd rather my child use marijuana to cope with mental health disorders than using pharmaceuticals, right? I'd rather them use marijuana. It's natural. It's better than if I use an SSRI or something like that. And so the talking point here, right, is that we really have limited research on that. We don't have long-term data to support marijuana use really quite as anything except for the Epidiolex we've had for seizure disorders for a long time. And so I understand why people could be hesitant for things like SSRIs, ADHD medication. They've all kind of gotten this really bad rap. When we had, prescription drug use and a lot of opioid, abuse. But the research that we do have related to marijuana use in a developing brain is not good. Right? It's not good. We do have long-term research on things like SSRIs, on mental health pharmaceuticals, on ADHD medications. We do not have long-term use on marijuana in a developing brain as a quote unquote treatment for these things, right? But we did found that they're more likely to develop other psychiatric symptoms potentially in the future, right? So there is a lot that are showing indicators of increased risk of things like schizophrenia, increased risk of anxiety, depression when using these substances. I know psychosis comes up a lot. And it's funny, I talked to the doctors kind of about this on Cairn's campus, and there's still a lot of theories on why high potency cannabis is leading to some psychosis. But what we do know is that it is, right? We can see that correlation. And so we need a lot more research to kind of try to figure out what the neurological effects are. But we do know that the risk increases for things like anxiety, psychosis, schizophrenia, if someone is using a high potency THC. So I also see parents who will say like, well, I'd rather them use at home with me where it's safer and I can control use. And I think, 10 years ago, 12 years ago, when I started at Cairn, I heard this a lot with alcohol, right? I'd rather my child's first experience be with me and it's safe and it's contained because I know they're going to experiment somewhere else, right? And so the talking point around this is that although it might seem like a better option, we actually know that the number one influence of substances for kids is their parents, right? So it is a mixed message to say you can do this here, but not over there, right? Or marijuana's okay, but these other substances are off the table, right? And that is a mixed message. And where there's mixed messages, especially for kids, right, who push limits, who take risks, who don't have a lot of that breaking capacity, right? That mixed message is a way to say, like, I don't really know what they're saying, right? Because they're telling me this, but doing something else. And that doesn't make a lot of sense to me, right? And I hear this from students, right? Like they're not saying clearly what I can and cannot do. It doesn't make a lot of sense, right? And ultimately, we shape their views of substances, right? So it's important to give a really clear expectation and boundary for our kids around substances. And saying you can use them at home but not at Johnny's house is not a clear boundary and expectation. It's confusing. Right. And I also pulled some data, related to, people will say to me, but in Europe, the drinking age is less and they have less substance use. And they actually might have less substance use. They do, in fact, though, have more alcoholism, right? They might have less access to substances than we do in the United States, but they do, in fact, have higher rates of alcoholism in countries where they don't have a drinking age or the drinking age is much lower. Right. Again, it's just not a message that's being shared necessarily with us in the United States. So some things I like to share with parents is once you know better, you can do better. So if you're sitting here or you're listening to this thinking, oh no, right, I've given a mixed message, or oh no, I haven't set a clear boundary, or I had no idea marijuana was so potent and I thought it was fine to use, right? You know better now, right? You can do better. I often give the example of, we used to put babies to sleep on their stomach and then we learned better. So we do better, right? Once we learn more data, we make better choices. And you can change rules and expectations. You're allowed to do that, right? That is in your capacity to say, I learned something new I didn't know. And so my rules and expectations are going to change now. So one of the things that comes up with that then is people will say to me, well, what if I used marijuana when I was young? How do I navigate that conversation with them? So I'm going to share this quick video. This is a previous colleague of mine, Gretchen, who now works in Philadelphia, but I really love the way she says this because no one can deliver it like she can. But this is a way that parents can have those conversations that I think is a really good message.
Hi, I'm Gretchen Hagenbuch with Caron Treatment Centers. I work in the Student Assistance Program, and I'm here to talk to parents about the dreaded question. What is the dreaded question? It is the question that most parents fear, and that is, hey mom, hey dad, did you experiment with drugs when you were my age? Did you drink alcohol when you were a teen? Our first reaction is often to lie or change the subject. Understand, this is an uncomfortable question. Always keep in mind, there's always a reason that they're asking. No matter what your answer, and I'm going to give you a recommendation, I do recommend that when this is over, you ask them, why are you asking me this? Because there's usually a reason. Also remember that parents are the #1 factor in whether a child decides to get involved with substances or not. So to the question. Before this question gets asked, I want you to think of someone that you have in your life or have had in your life. I want you to think of your friend from college, your coworker, a person from high school. Who is the friend that you can hold up as the example as to why you don't want your child to use drugs? Their experience, their substance use disorder, their addiction. And I want you to have the examples of how their life has been affected, so that when the question comes up, you can say to them, if you did use drugs when you were a teenager or tried them but didn't get addicted, lucky you. Yeah, I did smoke marijuana when I was in high school and I liked it for a little while and then I stopped. If I could guarantee you that your experience with drugs was like mine, that you would try it and maybe like it or maybe not like it and then stop and then go on to become the best person you could be, I would probably be less strict about alcohol and drugs. But what if you end up like Jim, Bob, Susan? What if you don't have my experience? What if you have their experience where they tried it, they liked it, they loved it, it set them free, and then it trapped them? That's the reason I don't want you to do drugs. And there's no guarantee of which way it'll go. That's all you need to say. Your past use isn't an excuse for them to use. We know so much more than we used to. And if you would like to know even more, I highly recommend our digital learning courses. They're free. There's a parent
All right.
one.
So I like that way of answering it because I think that's a question we get a lot of how do I navigate that conversation? And it is incredibly uncomfortable, right? I think that's also a piece of it is saying, yes, this is uncomfortable for me. But that's a piece of parenting, right? Is we're uncomfortable a lot. We have uncomfortable conversations, right? So I've had parents recently say, you know, if I use medical marijuana, if I have a medical card and I'm in a state where it's legal, how can I do it and tell my students or my children not to do it? Right. And what I say here is there is a difference between a developed and a developing brain. You know, this is a great image of this is all these neurons firing at age 5 versus age 20, right? Because at age 20, we've really kind of learned how to work, how to function, right? So if you're using something like alcohol, like medical cannabis, that is a choice you are making with your adult, fully formed brain that can weigh the pros and cons out, right? Our children do not have that capacity, right? Even if they're an old soul, right, who has wealth of information beyond their years, their brain is not fully developed. It is a risk to put something in that brain that could alter the way it works. And as a parent, our job is to help them grow up and be the most successful version they can be. And that's not a risk I'm willing to take. I love that way of saying it's not a risk I'm willing to take as your parent, right? So I want to just briefly talk lastly about school services as another avenue. For those of you who are not familiar, in the state of Pennsylvania, we have a mandate for a program called the Student Assistance Program, or SAP. And that is a team approach in every school building that takes federal funding. So everything besides private schools are required to have this here as a way to help reduce a barrier to a student's education, including things like substances. So SAP has been around since the 80s in school districts. This is the SAP data from the 2022-2023 data, or 2023 year. So in the state of Pennsylvania, we saw a little over 100,000 referrals. Okay, you can see where they come from, grades, what we saw. And I will share this PowerPoint as well, so you can, zoom in, have a closer look. But you can kind of see what they noticed. So externalizing behaviors would be things like substance use. Internalizing behaviors might be things like noticing that they're sad or crying or depressed, right? Or seeing concerns in a family. You can see what they recommended. So we've recommended consults with mental health providers. We've recommended assessments, which I talked about briefly earlier, that we do. But I wanted to share this with you because I think it's good to know that there is, a lot of different avenues for support. Right. And one of the things that the SAP teams do in schools is refer students if they're concerned. And when they are concerned, these are some of the data that comes out of what recommendations were made for students. So of, these discussions that we had around students, who was assessed and what percentage, indicated suicide, what indicated school consultations, what was recommended for these students. Right. And the PNSAS website, which is located right here, which is the Pennsylvania Network of Student Assistance Services, has a lot more data related to that. But one of the things that SAP does is we try to reduce risk factors and increase protective factors. Right. So I'm showing you this just because PAYS does ask about risk factors. So we look at, are they attached to community? How attached to students are they to their family, to their school, to their friends, right? And we look at that as risk factors. And again, I'll make sure you can see this and you can zoom in, because what I really want to focus on, though, to kind of round this out, is how do we focus as people who work with youth, as people who care about youth, whether that's from a youth professional perspective or a parent, is how do we reconnect versus disconnect, right? Drugs and alcohol often cause a lot of disconnection, whether that's because of isolation. In schools, it a lot of times means out of school suspensions, 45-day placements, expulsions, right? That is a disconnection to what they know and who they are, right? It could be a change in friend group. It could be isolation and loss of trust from family, right? All of those things are disconnecting. Our role is to reconnect. It's to give students and children a sense of belonging, whether that's to their family, to their school, to their community. It's to increase those protective factors and lower the risk factors. So what we can provide in schools, and what SAP does often provide, is prevention education, is early intervention, meaning if we have a student who's, tried it here and there, those lifetime use, we want to intervene then. Right? We don't want it to get to 30-day or daily use before someone's intervening, right? Karen does have a curriculum called Cannabis Awareness Reduction Education. We offer in a lot of the schools in the eastern side of Pennsylvania for free of charge for schools to try to help students see that reconnection versus disconnection, right? And how do we bolster some of these protective factors? And these are just some ways, what we look at, like how attached are they to community? How attached are they to school? One of the things I often ask students is, what are you doing at school? Are you involved? Are you in clubs, activities, sports, things like that? Because if they're not, and I find out they like things like art, I'm like, hey, let's figure out ways we can get you, right? That sense of belonging, that reconnection to things that you like to do in a more safe environment, right? It's that healthy brain chemistry, right? If they learn that when I'm feeling upset, I told an adult and that adult helped me get connected to a resource that was helpful, right? They take that message with them forever, right? And that's really important. So lastly, I just wanted to share some other resources that Karen has. We have a video series called Powerful Parenting Prevention in 3 Minutes. These are great for social media ad campaigns. We did some research on how long a parent will hover on a video on social media, and it's about 3 minutes. So we made them all around 3 minutes. We also have podcasts called Conversations That Matter. There's a phenomenal episode on there about cannabis from our former medical director, Dr. Garbely, on teen cannabis use. That's really, really good. They're all less than an hour. So hopefully in those commuting kids from wherever they need to go, you can get some information for yourself. Our website and our Facebook also provide weekly tips and tools, as well as our YouTube channel. We have a lot of resources, just like Be a Part of the Conversation does, to give you that information that you could benefit from. So you have these references here. And then lastly, I'll put this in the chat as well, but I just wanted to put my email up on the screen, because you're always welcome to reach out to me for resources, connection, anything like that. But I'm going to pass it over to Kim now.
Oh, thanks so much, Mallory. That was fantastic. And if you want to, I'll make sure that Bob and I grab the resources or any of those links that you just shared that Karen has, and we'll get those on that follow-up page.
Perfect.
I'm going to start sharing my screen now. So I'm going to talk to you a little bit more about this communication gap and kind of how we can try to bridge it. Let me get something out of the way here. Okay, great. Here we go. All right. So, we're going to focus on these roles today, several roles here. We're looking at the parents who, when we're talking about a communication gap, sometimes even mom and dad aren't on the same page, whether they're co-parenting or in their different households or totally unified on other things. It still can be a disconnect, because I work with a lot of family members, and I should disclose also the reason I do this work is I'm a parent. I have 2 children in their 30s now, but my son it has, thank goodness, a lot of years in recovery now, but I was going through this in his late adolescence and young adulthood until he finally found recovery at the age of 21. And so we were in it, we were going through it, and his dad and I were on the same page. However, I work with a lot of family members who, one parent is like, oh, come on, I did this in college. It's no big deal. Like Mallory was talking about, this is not that weed, that cannabis, or we have the other parent who is like, the sky is falling, this is, my child's going to die, and so we have a gulf, like this huge gap. And so if we can at least unify parents behind the scenes, whether it's talking with a peer specialist like myself, or a therapist or a counselor who can work with families to help them be unified, especially if they're concerned about their child's use. And so we can also look at healthcare providers, more on that in just a moment. And just also just culturally, what are we seeing as far as attitudes in our culture? We know that Mallory pointed out beautifully through the Pennsylvania Youth Survey how you can see the perception of harm coming down for kids. So the increase in use is there. But this is not just kids. This is also our culture who is seeing this as medicine, as healthful. They again don't see the potency as an issue. Kids are surprised when they see something that's low potency. Adults are surprised when they find out how high the potency is. And I was presenting with the school district last night. They were shocked at how high that potency is now that Mallory talked about. Okay, and so prevention and education providers too, obviously, and we have some folks with student assistance programs and others who are working with young people. So we all need to get knowledgeable and really work on that language and how we are presenting this to young people. And I think of all these roles as, I love this. This was this Canadian Center on Substance Use and Addiction published something called the Cannabis Communication Guide for Youth Allies. I'm like, oh, I love that term. So you'll find that on that follow-up page, that cannabis page on our website, that has a section on it about talking with youth. And I have this great PDF that they put out called the Cannabis Communication Guide for Youth Allies. And these are some of the ways that they describe allies as being approachable and trustworthy, non-judgmental, you can see here. So just really what I like to think of is like meeting them where they are, and thinking about if they are passionate about this substance, that it's helpful to them, and we're saying something that is so contrary to that, can we effectively communicate? So we think about this like, where am I in my views about cannabis, right? And we've got Mallory talked about the way this was viewed, like there was Cheech and Chong, like it's like, oh, you get a little buzz, you giggle a little bit, you eat a pizza and you fall asleep. I think Dave Fialco talks about it that way. And then you've got this movie that came out in 1936 that showed, look at this, they've got Satan there, trying to lure this woman into the evils of cannabis use. And they were using that word marijuana that was so stigmatized. And then you've got where we are today with it's healthful, and the billboards are so purporting that this is like a healthful thing, and it's called medicine, and it's called medicinal marijuana. And it is not actual medicine. It is not coming from a pharmacy. It is not FDA approved medications. And so we have a lot of different viewpoints, really varied. And so when we're talking with a young person, we have to think about, where am I coming from? What is my viewpoint? And is that kind of coloring the conversation that I'm having with my child? And if my child is experimenting with some of these substances, now what's my motivation? And for me, it was absolutely fear. When I talked to my son about his cannabis use, all I wanted to do was shut it down. I was speaking from a place of fear, which is not very effective. And again, thinking back like to when we were kids, if we had a strong feeling about something that we thought was helpful to us, and our parents had a very different viewpoint about it, we're not talking about like, is it a good idea to cross the street without looking both ways? We're talking about something that has varying viewpoints, like this is something that some people feel is helpful, other people feel is very unhelpful. So meeting them where they are and leaning into that as much as possible, and then sharing in a respectful way what our feelings are. So how can we do this? We can have very clear boundaries. We can say like, I'm willing to listen to what you think about this, but you need to understand that we're not okay with your using it. This is illegal. We're not in favor of it. We don't have enough medical, scientific evidence that this is helpful for the condition that you're telling me you have. We can have a united front with the other parent, as I explained, being transparent about a family history. So if there is that genetic predisposition, we need to share that with our kids. Like, look, we're a little bit more vulnerable to having a problem. And I love how that Mallory shared that video of Gretchen laying out, like your own use, that sort of thing. It's so important to be honest about that. And creating substance-free opportunities to have fun so that our kids aren't seeing that we need, whether it's alcohol, cannabis, whatever it is, to socialize, to have a good time, but to model that there are so many things we can do as adults. Our kids want to emulate us, even though they may not act like it or say it. They do want to emulate us and model what we do. So if we show that there are other things in our lives that help us to relax, that help us to have fun, to help us to socialize, they can see that and hopefully pick up on that. And also modeling healthy ways to manage stress and anxiety. We know that this is something that kids are struggling with mightily these days. And so healthcare providers, there's a lot of surveys out there now who are saying healthcare providers are very confused by all of this too. So if this is all confusing to you, you're not alone. We know that physicians surveyed said that they need more education. We need more research. The studies that have been done on cannabis are using potency levels of about 13% THC, and they're certainly not studying these high potency things on youth. So the medical community really doesn't have nearly enough information about this. And so quick, right hot off the presses plug here, we have a program coming up on June 8th. We're actually collaborating with Karen again on this, and one of their physicians, Mohammed Sarhan, will be presenting along with Dr. Libby Stout, who she is from Colorado, works closely with Ben Court, and she has been presenting on this nationally for years. But the two of them are going to be doing a free continuing medical education program. So go to your pediatricians, tell them about this. Bob, I'm going to tell you it's conversation.zone/CME. So that's where the registration will be. And this is truly, we just got ASAM approval this morning. Thank you, Jess Ayer. And so we are so excited to finally be able to present this, because I'm hearing from family members that they've got a 16-year-old who's been in the pediatrician's office and had the recommendation that they consider medical marijuana for their anxiety. I mean, this is just not medically supported. And so we really need to educate. This is not all healthcare providers, I'm sure, but there's some who are thinking this might be helpful, and there's just not enough evidence to support that. So Mallory already talked really beautifully about language and how important it is. So not using stigmatizing language about a neighbor, a relative, someone in our own history, in our own lives, but using that person first language, person struggling with cannabis use, substance use, whatever. And again, not calling it recreational. The legalization language is recreational marijuana, recreational cannabis. Let's call it adult use, because that's really what we're talking about. Recreational just sounds way too much fun. And Mallory already talked about marijuana being very stigmatized. Please call it cannabis, or call it THC. That's the psychoactive ingredient that gets people high. If that's what we're concerned about, that's what we should be talking about. So when we talk with youth, I'm going to show this 20-second long video. It's probably 15 years old, but I just love it. I'm going to play it for you right now. What? Can't hear it? Oh, so I was just told that you cannot hear that. I'm so sorry, Bob. Just let me know that you couldn't hear that. I don't know. So basically, it was mom holding up. You can see this is obviously an old one, because she would not be holding up a Ziploc full of cannabis. She would be holding up a vape pen or a dab pen or something like that. But basically, it's just them yelling at each other, not really communicating, and completely ineffective. I'm not going to try to fix that. It's not worth it for that length of time. But anyway, one of the resources we have on that follow-up page is our 3 buckets that helps family members to see, like, is my loved one just experimenting? We have a healthy conversation. I learned that it was just something they wanted to try. They really didn't love it. Good, great. We're done with it. Bucket 2 gets into continued use, but maybe some interventions like some counseling and some further conversation, perhaps some consequences, will help to circumvent this. Bucket C is where we are now no longer is communication effective or moving the needle here. They're isolated. We're seeing changes in hygiene, friend groups, isolation, and so forth. This is when it's time to engage with a professional to help us, because we family members cannot be expected to manage all of this on our own. So just a couple of talking points. Oh my gosh, no, we're okay on time, right? Yeah, we're good. Okay. Talking points. We have social norms. Mallory talked about this beautifully. We don't need to belabor this. Not everybody is using cannabis, right? Role playing. If your child says, I don't actually want to use these substances, but I feel like it's around me when I go to parties, and I've heard parents say this, their kid's best friend is getting into it. How do they deal with this now? So role playing is experiential, right? That is a way to learn how to have this language to use in the moment when you're confronted with the offer of hitting a vape pen or taking a drink, whatever that might be, to actually say the words, that I really don't want to, no thanks, whatever that is. And I love what I heard years ago from someone, that if a peer is really pushing something on a young person, that they can say, why do you care if I get high? Like, I don't want to. Why is that so important to you? That should shut it down pretty quickly. I love that way of kind of turning around that conversation. But just having that in their pocket so that they're equipped to say those words when they're in that kind of tricky situation with their friends. People like to talk about the gateway, or they don't want to talk about the gateway. And, there are so many ways that we can say, like, you know what, I don't know what the answer to this is, but I heard this person say this. We had this young woman on our panel one time who was in recovery, and somebody asked the question during the presentation. And she said, I think getting high is a gateway to getting high. And I think that says it all. I love that. It doesn't matter what the substance is. If you try something that gives you a dopamine hit, it could be your cell phone and scrolling TikTok. It could be hitting a vape pen. It could be a lot of different things. And you like the way that feels and you want more of it, that could be your gateway. So it's really doesn't matter what the substance is. It's just not a good idea to put that into your system at such an early age. If we sensationalize this, we're losing the battle immediately, because we need to, again, meet them where they are. They think it's healthful. We're calling it something really nefarious. We're going to lose that battle immediately. And no judgment. If we learn that, again, our nephew, the neighbor, whatever is using cannabis, and we start demonizing that person, how likely is our child going to be to say, I'm thinking about trying it, or I just saw that my big sister is doing this in the bathroom. They're probably not going to come to us, because we've already made it clear that we're really, really opposed to this and have a judgment about the person who's using it. And we can't scare kids. Again, Mallory talked about this, so I won't belabor that. So I just want to share very quickly some great skills that are called motivational interviewing. This is something that the therapeutic community knows about. We're not trying to make all of you clinicians out there, but I think these are just great tools. I find they're helpful in so many conversations, but there's many, many acronyms in this world, but one of them is OARS. And basically the first part of this is O for open-ended questions. So, having these conversations, by the way, is not easy for our kids. It's not easy for us, but if we have some of these tools, I think it might be helpful. Instead of that lecture that I told you that I got into with my son, I wish I had these tools. So I wish I had asked him some of these things, like what I wish I asked was, why are you so passionate about this substance that alters your mood? Talk to me about that. I would be really curious to know how you feel it's helping you. Are there some other things that might be helpful to you instead of cannabis? How do you think I might be able to help you, right? Affirmations, like positive things, right? You worked so hard this week. Like, I can see how much you care about feeling better, about you want to take care of yourself. It sounds like you're looking for ways to feel less anxious. That's great. Let's go down that road. And I appreciate you being honest with me. If they're telling you the truth, let's for sure celebrate that, right? I'm so glad you told me the truth. Sometimes it's really hard to hear those things. When my son finally started coming clean about some of his substance use, man, that just sent me back into that fear spiral. But I wish I had been calm and said, like, wow, I'm so glad you told me. Thank you for being honest. I know that was really hard for you. I'm reflecting. If they say, I don't think weed's really my problem, we reflect that back by saying, so you feel like cannabis use hasn't really caused you any real problems. Well, sometimes I feel a little, so you can see where this goes. You want to reflect it back so that they know you are hearing them. This is so validating, like you heard what I have to say about this. And then we can, at the end of that conversation, kind of summarize it by saying like, okay, so it sounds to me like this is what happened. Do I have this right? Is there anything you want to correct? And then you can go from there, so here's just sort of like wrapping up that ORS. And that's all that I have, but I would really love to hear from you or on this call, or Mallory, anything that you wanted to say as a follow-up.
I would say too, the concept of ORs, it seems really easy in theory. I like the way you laid it out, Kim, because I think we can read it and be like, oh yeah, I affirm people. And then if you actually think, we tend not to. We tend to, go from this place of fear, especially as a parent, because we never want our kids to be uncomfortable. We never want, them to feel sad. We never want them to tell us something, that would change the trajectory of this vision we have for them in our head. And I think sometimes that gets in our own way of having those conversations, of being open to that and really affirming. So even just, hey, I'm curious. Even if your child or student is not using substances, I'll often say, like, I'm curious why you think people use substances, or I'm curious why you think your friend's using cannabis, just to start that open dialogue of less judgment. I think that's an interesting concept of, I like said of like continuously checking in, right? Because perceptions will change just based on peers and what they're seeing and what's highlighted in the school and things like that. If they're constantly highlighting the students who are disciplined for policy violations, that kid's going to change that perception for students of, wow, that's everyone, or everyone's getting in trouble for this. So it's just that reminder to constantly have that conversation. And throw another one out there too, just young adult. The research we have related to like young adult alcohol use is that it's actually more likely for them to not drink through college than it is to drink, which I know for people are like appalled. They're like, that can't be. But that's what the research shows us. So again, it's just that we've been conditioned to think college drinking, right? In our culture, they just go together. But in reality, there's no data to support that.
I mean, I've got some thoughts. I'm sure you do too, Mallory.
Go ahead, Kim.
Yeah, I would just say, that to offer, like, I've been learning a lot about this lately, and I would really be happy to talk with you about it. You said you did some research, but I'm curious what the sources are. The reality is that if you just kind of do a blind Google of, medical marijuana, yes, you'll see plenty of things from the cannabis industry that purport its benefits. It's really being very particular about the sources of that information, and you can cherry pick this stuff all day long, but you can share that, like, if you're interested to learn what I've learned from the behavioral health community, I'd be happy to share that with you so that you're not kind of force feeding. It's tough with family members, right? We don't want to burn bridges in our family system. So, but I think you can at least offer that. Mallory, other thoughts?
Yeah, I was going to say the same thing. I think when you say research, like I think it's interesting to see where it comes from. Like I always try to pull things from the National Institutes on Health, or like things that we know, again, are peer reviewed, coming from medical doctors, that aren't just cherry pick statistics around like, oh, there's this. It's funny. I was actually just listening to a podcast with Sanjay Gupta, who has been really kind of pushing rescheduling and cannabis. And he was talking about this one girl he saw who, the Charlotte who had, the seizures. And I'm like literally driving, screaming in my car. I'm like, one person, like, like this, we know that child epilepsy is terrible. And if there's a solution for that, absolutely. But are we going to use that to say it's helpful for all these other things? Is just a mixed message. I just think it's, where is that research coming from? Where is that viewpoint coming from? And yeah, I think coming at it, like Kim said, like, again, I think people, especially parents, are worried that like, I made a mistake. Am I going to be shamed? Am I going to be, are they trying to lecture me? Or, so it's coming at it from a way of like, hey, I learned this information that I didn't know. Right. Or, hey, I'm wondering if you would be interested in learning some things I heard, from these medical docs. Or on June 8th, there's a really great presentation specifically on, children's use or adolescent use that could be beneficial to just continue to learn more. Because I talk to kids sometimes, I'm like, there used to be prescriptions for alcohol, pre-prohibition. There used to be doctors recommending cigarettes to thin mucus if you had a cold. And now we think, well, that's insane. Why would anyone say that? And we could be saying the same thing in 50 years related to this. We just don't know that yet. But we don't have that long-term research. So it's also that reminder that it's okay to change expectations. It's okay to change your mind. It's okay to have said, hey, we thought this would be helpful, but now we know better. And so giving the grace to say, like, it's okay to change your mind, or would you be interested in hearing more related to that? But I know it's tempting to pick them up and shake them sometimes. As you see me driving down the road screaming at my car.
At Sanjay Gupta.
Yes, exactly.
And you're reminding me that I often will self-disclose that I used to be very cavalier about cannabis. I probably called it marijuana. I used to have these attitudes about, I think that helps too, to show that like, I didn't come from this, like from ground zero as a prevention person, I really did think this was not a big deal because I was thinking about what my experience with it was a million years ago. It is not the same thing. And boy, I've learned so much. So that's really, I think, a gentler way to come at it. Like, just to, not to say like, boy, wasn't I naive or whatever, but just like, this is all the information I had, and when we're getting most of it, there's a whole lot more money behind the cannabis industry than there is in the prevention or behavioral health fields, and and by the way, Charlotte, the little girl with Dravet syndrome, she actually has since passed away because, not related to her medications, but just because Lennox-Gastaut or Dravet syndrome. I think she had Dravet syndrome. They're very, very challenging seizure disorders to have. But there is now FDA approved medication for those conditions. You don't go to a medical marijuana dispensary for those. So I thought he got off that bandwagon. I'm sorry to hear he's still talking about Charlotte.
It was just released, I want to say Friday. So nope, we're still on the bandwagon. But again, I think there's a lot, like, I'm glad you brought that. There's a lot of lobbying behind it, right? There's a lot of money. There's a lot of lobbying. There's a lot of politics behind all of it. And I think one of the interesting thing about talking to kids specifically, maybe not parents, but kids, is that they don't like to be manipulated. Like, especially this generation of youth does not like to be manipulated. They are the generation that drinks the least amount of alcohol because they're more in tune with health. They're more in tune with their bodies. If I ask kids when I was younger, like, did you go to the gym? Like, that wasn't like, people weren't working out. I often joke, like, I went through college and I don't think I ever took a sip of water. Like, I don't think that was ever like a thing we did. And now I have to send my kids to school with 3 bottles of water. So we learn so much more that we just didn't know. And, we can grow from that and learn from that. But also teach them to think critically of like, hey, what research are you looking at? Where did you pull that stat from? Did you just Google it and look at the first article? Who's funding that article? Ben's book, Weed Inc., is a phenomenal resource just in terms of the commercialization and the lobbying of the marijuana industry, because it's fascinating to see where that money's coming from and what it's doing to push. And again, kids don't like to be manipulated. So sometimes when you tell them that, they're like, wait, what? Like, I'm in this, I'm being manipulated. Let me do my research.
Right. Yep. Great point. The name of the book that Mallory mentioned is Weed Incorporated, Weed Inc. Oh, thanks, Mallory. He actually has a new book coming out really soon.
So
To
excited.
follow up. Yeah, yeah. Looking forward to that.
Yeah, that was my vacation reading material when that first came out.
Aren't we pathetic?
I know, really sad. I know my husband was like, really?
Yeah. No beach reads for us.
Yeah, it's fascinating.
Great. Well, Mallory, it's always a pleasure.
You too.
Thanks so much for doing this. And thanks,
Of
Bob.
course.
Thank you all for being here.
Thanks, everyone.